Hello guys, welcome to our today's lecture for oral pathology as well as oral medicine and radiology. These are the topics which are very important not only for the exam point of view but also for the clinician point of view. During your day-to-day clinic practice, you will be asked various questions from the patient from the diagnostic point of view. During your interviews also, you will be asked what are the characteristics of this disorder, how to identify or how to make sure that this is the differential diagnosis of this disorder. So what I mean is, before proceeding with today's lecture, you have to go with overview of any topic. You must know all the sentences or all the content of the topic which you can represent before anyone. For example, if they ask you what is leukoplakia, so in your answer, you have to go in a descriptive manner. For example, if leukoplakia is to be explained, you have to tell leukoplakia's definition first, then its causative factors, then its clinical features, then its differential diagnosis, then its investigations, what else investigations you will do, then its treatment. So the meaning of the story behind this lecture is it is not that you have to mug up and forget it because the same content is to be produced next year. So it's a combo of oral pathology as well as oral medicine. Let all the students mark their attendance. Afterwards, we start today's lecture. In today's lecture, we will just give an overview of oral pathology preparation and how we will prepare notes. We will just guide you how to be confident in writing notes, how to recall them, and the notes which are useful for passing your theory exam. We will help you this way. First of all, what we'll be discussing is how to pass oral pathology. Okay, so for first of all, you have to concentrate on theory exam because most of the theory, if you are perfect, if you are easy with this theory, then you will be helpful or you will be easily passing practical exam. Okay, so what happens in theory only students fail. In practical, students are passed. Okay, now the thing is, what is the syllabus? First of all, you understand the syllabus of your theory exam of your oral pathology. Okay, now we will discuss about its syllabus. Okay, so what happens if you go with the perfect syllabus? You will able to pass easily. First of all, you go with the previous repeated questions or previous year questions. First of all, the first question is leukoplakia. Okay, then lichen planus, then OSMF, then figures. Out of these, one or two questions will be there in your theory exam. Okay. After this, what they do is they ask any cyst like Dentigerous Cyst, OKC, or Calcifying Epithelial Odontogenic Cyst. Okay. From these, one or two questions can be asked. Now they come with tumor. Okay. In this, amyloblastoma, then adenomatous odontogenic tumor, Winborg tumor. Okay, so these are the few important tumors which will be asked. Okay, now they go with bone disorders. In this, they have fibrous dysplasia, SLOS, Paget. Okay, now they come with pulp and periapical or periradicular disorders. In this, they have various questions like radicular cyst, then periapical granuloma, then periapical abscess. Okay, then all this pulp related question, pulp polyp. Okay, in the initial stages of pulp disorder, we have irreversible pulpitis. Okay, so what I have written on the screen will make your theory exam paper. So it will be easy for you to score 50 to 70 marks. Okay, so now what we will do is you have to make notes of each and every questions first. Okay, afterwards you have to go with the recalling or how to make notes. That is important. So now we will make you learn how to prepare notes. All these are important questions. Okay. Now how to make notes. Okay. First of all, your syllabus. Now notes. So before presenting any question, in every question you have to write index first. For example, question is asked, classify cyst of oral cavity and describe dentigerous cyst in detail. So what we will do, we will write first index. Okay. So what will be in the index? First of all, as the question is asked, you will write classification first. Okay. After that, you will write Dentigerous Cyst. Its definition, then its etiologic factors, then clinical features, then histopath also, because in oral pathology they are concerned with histopathology. Okay, then differential diagnosis, then investigations, then treatment. So what I have written here, index, it should be on every questions, whatever you write in theory exam, it should be on the first page. Some error has been there in recording. Please comment whether you are able to view this live channel or not. Please comment in the box whether there is a continuity of this lecture or not. After this question is prepared, you have to go with elaboration of each and every point: definition, etiologic factors, histopath, differential diagnosis, investigation, and treatment. So, in short, what we have taught you is, first of all, prepare a question bank. Okay, then that's your target. Afterwards, you have to make a list of all the questions. That is the question bank. After that, you have to complete 1 or 2 questions per day. So what does it mean? It means that you have to go with 1 or 2 questions per day. How? You have to attend our lecture, then prepare notes. What will be included in the notes? Index. Okay. Then elaboration. Now, what is this index and why we are making you to write this index? Because if the question is of 7 marks, you have to write more. And if it is of 5 mark, you have to write according to that. Okay, so this is important. Now we come to our today's topic. Till now, if you are having any doubt, please let me know. So we will start with our lecture with the topic of odontogenic cyst.